Okay, so we're looking at Tom today for right hip pain. We start by watching Tom walk, and we notice as he walks that he doesn't load his left hip super well, and he seems to get a lot of right pelvic rotation. We then have him stretch his stride out, and we notice that he falls into quite a bit of left hip adduction when he lands on the left side. Kind of gets this left lateral shift. We then have him do lateral jump to see what he does there. We notice his load on the left does not look super awesome. So then we move into squatting and watch that Tom seems to be shifted over, especially in the more narrow squats, over on his right leg the entire time while he's squatting. Doesn't seem to get onto his left very much at all. Then we move into forward and backward lunges, and the right leg looks pretty good. He loads well on his hip, his knee, his ankle. Looks pretty stable there. Left leg, get a lot of wobble there. Doesn't seem like he can get very much stability on that left hip at all in this position. So then we go to take his leg away and do single leg squat position right side. Pretty bomb proof there. We go left side, lots of hip adduction, internal rotation, hip flexion. Then we move into looking at how he loads in the frontal plane, right to left. Look if there's any restrictions in abduction. On the opposite side, looks good. Looks like he can get over there and load in the frontal plane okay. So then we move into looking at his anterior hip mobility, his hip extension on the right with internal and external rotation, seeing if there's any type of restriction there that might be stopping him from getting onto his left leg. So we watch him do this on the right, which looks a little bit restricted. Then we move over to the left, the same assessment, comparing right to left, which also looks a little bit tight. So we decide we should move on to the table to check passive range of motion. So we check, again, hip internal external rotation and flexion, which on the left looks actually pretty good.
What's up, dude?
Do a Scour's test, just to make sure there's no labral issues. Favors test. Then we do the same thing on the right side. Again, hip range of motion seems pretty good. A little bit of hip flexion limitation on the right. A little bit of tightness and pull in the front there. So we decide to go ahead and give Tom a right hip mobility exercise to help him get onto his left leg a little bit better, because he does seem tight in his right anterior hip. Also, this gives him something to do to alleviate his pain when he's out touring. So we give him a standing hip extension, external rotation stretch here, and then also give him an around the world stretch to kind of get after that inferior anterior capsule. We also give him a kneeling stretch, just get a little more isolated to again help him get off of his right leg onto his left leg a little bit better. So you see him doing with rotation for external rotation extension, and then we also have him do his leg out. We're just making sure he gets his pelvis in the right position here. We also have him rotate his leg out. To give him that hip internal rotation extension as well. On the next session, you see him doing a nice single leg squat here on his right leg. It looks super strong, super solid. Then we look at his left leg, and he can't even hold that. It's really difficult for him to do that. So we know we're on track here. Okay, so then we want to work on getting Tom some hip abduction and adduction control. So you see him on the right side here, leaning over to the right, getting a good right trunk lean. He's getting some right hip abduction there, and then back to neutral. Not very difficult for him. That looks awesome. Then we're going to move over to his left side, which should be a little more challenging. And again, we want now a left trunk lean, and we want to see that right or left hip abduction. Has a hard time getting back into that adducted position. have to give him some feedback there with kind of where to go and what to do. He wants to twist, and he also doesn't want to tip that trunk over to the side very well. But he's getting it there. But it's definitely challenging. He's having to think about it quite a bit. This was his first homework exercise. Then we go to the rotational plane. I'm trying to get him, again, kind of in that good abducted position, giving that real bone external rotation on the femur, and then getting that relative hip internal rotation on the right side. He does pretty well here. Then we go over to his left side, and he really struggles. See him trying to lean over to the right there, getting that hip adduction, which we don't want. We want him to get more of a neutral and abducted position on the left, which he's struggling to do. We also want to get real bone femur external rotation, and then get that pelvis rotating to the left, which he's really struggling to do as well. So this was his second piece of homework for that normal control.